Teeth clenching is a very common problem. We've seen a lot of it in the last couple of years due to the stresses that have been added to people from the pandemic, COVID, and just stresses at home and things like that. Tooth clenching is something that's very hard to prevent because it typically happens at night when you're sleeping. So there's no way to say I'm going to not do that anymore. You can't just make that decision because it happens when you're in deep sleep and nobody's there to wake you up and tell you to stop. So what we do when we see patients who have teeth clenching is we make a bite guard for them. And the evidence that we see when people are clenching, it's pretty easy. We can see evidence of tooth wear. Usually the muscles are tender and the mastication muscles can be tender. Sometimes the joint can actually hurt. The TMJ can be very sensitive. The temporomandibular joint can be tender and pop and click. And that's really important because that typically progresses and gets to the point where it can have chronic pain if not managed properly in the beginning. So we have a real easy way to do that. We make a bite guard that helps the patient's jaw be in a more relaxed position and allows them to freely move around at night and supports the jaw so there's no damage. It also protects the teeth long term, and that's a real common issue that we see with patients nowadays. And sometimes it happens from early on. You can have it happen as a teenager, even an adolescent, but we see it also in elderly patients too, sometimes due to medication. So it's something we keep a close eye on, but it is something that we can correct and provide treatment for with good success.